Welcome to Share the Health, a new podcast from the Ross County Health District, where we discuss health issues that affect our community. I'm your host, Sarah Smith. Today I'm joined by Ross County Health District Director of Ross and Pickaway County WIC, Rebecca Ward. Welcome, Rebecca.
Hi, thanks for having me.
How long have you been with WIC?
So I have been with WIC since 2021. I worked directly with participants as a health professional in Ross County and Franklin County before becoming the Ross Pickaway Director in 2023. And I've absolutely loved that transition. I still get to have occasional one-on-one interactions with participants, but I also get to work on more of a macro scale to create more widespread positive impacts across these counties.
That's great that you had experience working one-on-one with the clients before becoming the director.
Absolutely. I think it's great to be able to connect with my team that way.
So can you describe your role as director a little bit?
Yeah, so my role on the day-to-day is to oversee clinic functions and help my team during really complex participant situations. I help write the local grant on a yearly basis and provide quarterly program updates to Ohio WIC. An important part of my role is to make sure I'm up to date with Ohio WIC's policies and procedures so that I'm not only helping our community to the best of my ability, but also helping my team succeed. As a director, it's crucial for me to be a proactive problem solver, to take pressure off of my team and be able to provide direction confidently. A director is so much more than just a manager. That's something I've really learned the past couple of years. Director is very much a leader, and I take that title really seriously.
What are some of the services that WIC offers to mothers and children?
So WIC provides nutrition education, breastfeeding education, and support. We provide supplemental highly nutritious foods like cereal, eggs, milk, whole grain foods, fruits and vegetables, and iron-fortified infant cereal if that was needed. And we also provide referrals to prenatal and pediatric health care and other maternal and child health and human service programs. The program improves pregnancy outcomes by providing or referring eligible women to support services necessary for full-term pregnancies. It reduces infant mortality by reducing the incidence of low birth weight. So infants under 5.5 pounds are at greater risk of breathing problems, brain injuries, and physical abnormalities. And of course, WIC provides infants and children with a healthy start in life by improving poor or inadequate diets.
So how long has the WIC program been in existence?
It has been in existence for over 50 years,
Wow.
Which a lot of people don't know. WIC celebrated its 50th anniversary in 2024. It started as a 2-year pilot project in 1972 and became a permanent program in 1974. And actually, the first official clinic opening was in Pineville, Kentucky, which is only a few hours south of our Ross County clinic. And within its first official year of operation, WIC expanded to 45 states. So I think that really shows how impactful it is.
Definitely. To start out as a 2-year pilot, and now the fact that it's here over 50 years later, that shows how impactful it really is.
Yes.
Yeah. So how is WIC funded?
WIC is a public health nutrition program under the United States Department of Agriculture, also known as the USDA. The USDA Food and Nutrition Service, also known as FNS, drafts WIC's annual budget proposal for the federal fiscal year, which runs through October 1st through September 30th. Congress determines the level of funding that the program will receive each year. And then once the appropriation passes Congress and it's signed into law, grants are provided to each state and then further administered down to the local level by county.
Has WIC been affected by some of the recent government changes?
So WIC's a federally funded program, so we do keep an eye on policy and administrative updates that come from the national level. That said, the core purpose of WIC hasn't changed. It's still focused on supporting the health and nutrition of pregnant women, infants, and young children. Most of the time, any government changes involve adjustments to guidance or program operations rather than the services that families rely on. Locally, our goal stays the same, which is making sure families have access to healthy foods, breastfeeding support, and nutrition education.
What is the program eligibility for WIC?
WIC is designed to support pregnant women, new mothers, infants, and children up to the age of 5 who may need help accessing healthy foods and nutrition support. To qualify, families generally need to meet 3 main criteria. First, they must fall within certain income guidelines, which are based on household size. Many families who already participate in programs like Medicaid or SNAP automatically meet the income requirement. And if they don't, we generally base their eligibility on the past 30 days of income for the household. But of course, there are other income situations that may require a different approach. Secondly, applicants must live in the state where they apply. And third, a WIC health professional must determine that there's a nutritional need. That can include things like growth concerns in young children or just the need for nutrition education and support. The process is really straightforward, and our goal is always to make it as easy as possible for eligible families to enroll.
How long does WIC eligibility last?
Generally, a participant has a 1-year certification, and then after 1 year, they have to provide updated information to determine if they are still eligible.
Is there a certain age that a child can remain on WIC for eligibility?
So they are eligible until they are 5 years old.
Can you walk me through what a typical WIC appointment looks like?
Yeah, so at the first appointment for someone new to the program, they will provide eligibility documents to our front desk clerk. We require to see IDs, proof of birth, if it's for a new baby, proof of address, proof of pregnancy, and then proof of income. And as I mentioned earlier, having active Medicaid or SNAP lets us know you're eligible for the WIC program without having to look at the income guidelines for the household size, so that's really nice. The clerk will ask a few more questions, and then we'll be able to determine if you're eligible. The participant would then fill out health assessment forms for each person in their family signing up, and these go over more than just nutrition. They're holistic to try to paint a bigger picture of who this person is medically and what they might have questions about or might need referrals for. And then they're taken to the medical lab where we check heights, weights, and hemoglobin. And finally, they sit down with a health professional, which is either going to be a dietitian, dietetic technician, or a nurse. They'll review the health assessment forms and then discuss their diet to assess nutritional risk. And then from there, the participant sets a nutrition goal based on what was discussed. And goals can really vary greatly. So anything from offering milk in a cup for a child who's old enough to transition off a bottle to decreasing sugary drinks for someone that's been newly diagnosed with gestational diabetes, or trying to eat more iron-rich foods throughout the day after learning that they have low iron levels. So the goal really is unique to each person. From there, the health professional assigns a monthly food package based on the participant's preferences, allergies, or medical conditions. So, for example, if someone reports that they have lactose intolerance, we will customize the package so that it has either lactose-free milk or soy milk. And if someone has a peanut allergy, they can choose beans as a secondary protein source. It's loaded onto a card and is ready to go as soon as they leave the office.
So along those lines, where can WIC participants use their benefits?
A lot of places accept WIC. We have 12 approved vendors across Ross and Pickaway County. We have, of course, the standard large grocers like Kroger and Walmart, but we also have smaller grocers further out of town, which is really great for the participants that live further away from the city centers. And any WIC participant in Ohio can actually shop at any WIC-approved vendor across the state. So you don't have to shop inside your county, but it is important to note that it's not going to work if you cross outside of the state. And something else I'd like to add about the cards is that unlike SNAP, where unspent benefits are rolled into the next month, unspent WIC benefits do expire at the end of every month. So it's recommended to use your WIC nutrition card before your SNAP benefits.
So use it or lose it, basically, for
Yes.
WIC.
Yep, absolutely.
Yeah. How many months of benefits get loaded onto a card at once for a participant?
Although they are certified for a 1-year period, participants do need to come back every 3 months in order to get future months loaded onto their WIC nutrition card. They receive some form of nutrition education at every visit. And then halfway through their certification period, so around that 6-month mark, they meet with a health professional again to discuss any diet changes, see if they met their nutritional goal, and discuss the need for any new referrals. The whole process generally takes 1 hour if you are new to the program or have many people in your household that are being signed up. Not all appointments will be that long. Some are as short as 5 minutes.
WIC also started recently a breastfeeding support group, right? Can you tell me a little about that?
Yeah, so we started the breastfeeding support group here locally to try to close the gap, to try to improve the well-being of the women we serve, and also try to improve breastfeeding outcomes. And that's something we track really closely. Not everyone has support from family or friends when it comes to breastfeeding, and there are a lot of myths that go around. We just wanted to provide additional support and education to really try to make a difference.
Who can attend the breastfeeding support group?
Any active WIC participant that's pregnant or postpartum is welcome to join. Although it's advertised for Ross and Pickaway WIC participants, we are more than happy to have participants from other counties join in. So we even have a virtual option for convenience. Our breastfeeding peers host the groups and aim to keep topics pretty loose to really let the conversation be based around what participants are asking or sharing. The group is a great way for moms and moms-to-be to support one another, because sometimes, especially in those early days, you can feel pretty isolated, like no one else is going through those late nights or having latch issues. So it's been a really great addition to our clinics.
How often does the breastfeeding support group meet?
In Ross County, the support group meets the last Thursday of every month from 1 to 2 here at the Ross County Health District or virtually. In Pickaway, they meet on the first Thursday of every month from 1 to 2 at the Pickaway WIC clinic or virtually as well.
What can WIC clients expect to receive as part of the program?
They receive supplemental food benefits every month, depending on whether you're pregnant, breastfeeding, not breastfeeding, or the age you are as a child. You'll get a slightly different food package. In general, though, a participant can expect to get some dairy items like cow's milk, cheese, and yogurt, a certain dollar amount to purchase fruits and vegetables, whether they're fresh, frozen, or canned, eggs, peanut butter, beans, whole grains such as bread, pasta, or tortillas, and breakfast cereal. There is a large variety of items and brands that are WIC approved at grocers that accept WIC. So there's really something for everyone, and Ohio WIC continues to expand options to better serve people from all backgrounds.
It definitely sounds like you have everything available for a balanced diet there.
Absolutely.
For moms and kids.
Yes.
And Rebecca, I know you also have a farmers market nutrition program. And can you tell us a little bit about what that entails?
Absolutely. I think there are a lot of people that aren't really familiar with the farmers market program. I think it's a really great addition to all the things we already do. So it's in almost all of Ohio's counties. In 2024, it served over 27,000 Ohio participants in 70 of our 88 counties. So it's really impactful. So what it is a supplemental program to the WIC program that provides coupons to buy locally grown fresh fruit, vegetables, and herbs from farmers markets, and farm stands. It runs from June through October every year, and it's cool because it really serves a dual purpose. It provides another opportunity for our participants to improve their diets and learn more about farmers markets, and it helps support our local farmers, which I think is awesome. Local WIC staff are present at a lot of the approved markets throughout the summer to issue the coupons and provide additional nutrition education related to the importance of these foods, and it's a really fun time of year for us. It gets us out of the clinic to do something a little different. Last year, we had record coupon redemption rates, and we're hoping to continue that trend this year.
Yeah, that's awesome. Yeah, anytime we're able to help funnel dollars back to local vendors and local farmers, that's a wonderful asset of that program as well.
Yes, I know local farmers, nationwide are struggling more than ever. So I really like knowing how much we're helping them.
Are you able to share some favorite WIC success stories or team wins from your staff?
Yeah, I think two things come to mind for team wins. So a recent team win would be our breastfeeding peers getting work cell phones to be able to modernize the way they contact pregnant or breastfeeding moms. People are a lot more likely these days to respond to a text, especially when they're busy with a new baby, over answering a phone call. So they've shared that they've been able to get in contact with a lot of moms they previously weren't able to. It's also created a much more modern way to send helpful images or videos. Another one is something that goes on every day in our clinics. When there are walk-in participants, which are just participants that aren't on that schedule for that day, the health professionals are open to fitting them in if they're able to, which I think really speaks to their genuine passion for helping our participants, because that is not a requirement. And that's absolutely a daily win that I always notice and definitely never take for granted. I'm blessed with a really hardworking team, from my front desk clerks to my office manager to my health professionals. They're really all wonderful people.
Yeah, you've got a great team over there in WIC, Ross and Pickaway County.
Thank you.
So for you, what is the most rewarding aspect of working with WIC?
The most rewarding aspect of working with WIC is absolutely those special moments where you see a mom's eyes kind of glisten when she gets the support she needs. So whether it be because she was able to increase her milk supply after we provided education, or because we connected her to a resource that will improve her family's well-being, like those moments really just keep us going.
Yeah, I'm glad that our local moms and kids have the great WIC staff and director in you to help guide them through their processes of being a new mom with new kiddos and getting all of the balanced diet that they need.
I appreciate that.
Yeah. Rebecca, can you share with us what the biggest challenge of being a director at WIC would be?
Absolutely. So I think one of the biggest challenges can be implementing really large policy changes. These changes would come from the state program, and it's my job to make sure I have a deep understanding of it. I'm able to break it down to my team in a way that they can make sense of and create a game plan on how to smoothly implement it into my clinics so they don't have to carry that burden alone. There's very much a delicate balance of needing to implement the change promptly while also ensuring that my team feels supported. It's just really important to me that they feel heard during any level of change.
And so, Rebecca, anyone interested in signing up for WIC, they can go to signupwic.com to sign up nationwide for WIC?
Yes.
Perfect. Well, thank you so much for joining us today and taking the time to tell us a little bit about WIC.
Thank you. I had a great time.
Thanks so much to Ross County Health District Director of Ross and Pickaway County WIC, Rebecca Ward, for joining us today. For more information about Ross and Pickaway County WIC, visit www.rosscountyhealth.org/WIC. To sign up nationwide for WIC, visit signupwic.com. Visit our website at rosscountyhealth.org for more information about all of our programs and services. Until next time, take care and share the health.